This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome into the human side of healthcare. Thomas Miller along with Steve Love.
Thanks. Great to be here again.
This is going to be a great conversation. Have you ever wanted to have a career in healthcare? Steve, yours is how many years now?
Unfortunately, it's roughly 45 years.
Goodness sakes. And I found my way into it by default of sorts, but we have somebody who speaks quite eloquently to this topic. John Phillips. He's the president of Methodist Dallas Medical Center. John, welcome back to the program.
Well, thank you. It's an honor and to be here. Thank you very much.
I know that you are passionate about what you do. You're passionate about the work, the hospital, the facility, and taking care of patients. Last time you were with us, you talked about how you got into this field. What do you tell people who ask you about getting into the field?
Great question. First thing I like to share with people, and it doesn't matter where they are in their career, it's amazing how many people that we have working in healthcare as a nurse or a technician or in finance, and it's a second career or maybe even a third career. And so it's okay not to know is the first thing I like to share with people. You don't always, especially maybe some of our younger volunteers that are in high school or college age that come to our hospital searching for maybe a career and they just don't know what they want to do, and that's okay. And sometimes their parents don't like to hear that because as a parent of teenagers, I want my kids to know exactly what they want to do, but it's okay not to know. And I share with them that they should explore. A hospital is a great setting, and there's many other healthcare settings as well. It's a great setting to explore many different careers to see, do you want to be a doctor, a nurse, someone in finance, a case manager, a social worker, someone that works in culinary in the kitchen, you name it. Hospitals are just one example of in healthcare of where people can volunteer their time as they're exploring careers to see, is there something that they didn't know that they could be passionate about that really excites them that they could pursue.
Steve, you are now president and CEO of the Dallas-Fort Worth Hospital Council, but you came in through the ranks of the financial area. So you're a numbers guy, right?
Yeah, I'm a numbers guy. I started out at a CPA firm, and we happened to audit a large hospital, and I learned a lot about the hospital, and I fell in love with healthcare.
Now, there are a lot of people out there that are not numbers people. Some are not. Do you have to be a numbers person? I mean, what if you don't do math? Both of you guys can jump in on this, but what if you're not math proficient? Can you still have a good career in healthcare?
Oh, absolutely. You don't have to be a numbers cruncher. There are so many other areas you can do, and John can probably just name positions at his hospital where people do a great job at what they do, but it's not business-oriented or number crunching.
And it's fun to see those people come together. So we have our finance people in healthcare, just like any other organization will have their finance people. And then you have those people that are really good at maybe strategy. And then you have those people that are really good at taking care of the customer. In our case, it would be our patients and our families and our staff for that matter. And it's when you pull them together, and if you need that numbers person, well, you get the numbers person with the other people. That numbers person gets what they need. That's when you see the magic happen. So healthcare is a great example of a field where people with multiple different talents can come together and be very successful.
Another area is technology, and technology is changing so fast now in the medical community. What do you see in the future, and especially people wanting to get into the technology side of healthcare? What should they look at?
Just a few years ago, I think I would have said primarily that's around information technology, electronic health records, electronic medical records, people that are needed in healthcare to primarily work on EMRs or electronic medical records. And that's still true to this day. I would also say now people that love robotics or understand or have an interest in artificial intelligence or AI. That is where the future, a part of the future of healthcare is going, because it's all about improving healthcare, lowering costs, and providing better care for patients. And those are just a couple more areas where we're going to see more and more demand for smart people.
One other area that I know is shifting in this field, like it's shifting in almost every field, and that is the impact of the millennials. How is the delivery of healthcare going to change over the next decade, do you think?
So an example today of this is we have a millennial nurse manager at our hospital, and she has pushed me in so many different ways that are so positive, but they're so uncomfortable for someone that's not a millennial. So you millennials, keep it up, all right? And the rest of us will keep an open mind, but she has her staff meetings via Facebook Live. And I was so concerned about that. And I thought, well, you can't do that, right?
HIPAA.
And so we just don't share, certain information in a staff meeting. But I've got to tell you, and I'm so proud of Methodist Health System, if I can say that. We have now had, I believe, 5 Facebook Live surgeries that we broadcasted via Facebook. And the most recent was a live awake brain surgery that we did via Facebook Live. That's an example of how smart people, they could be millennials, they could be at any other generation, who are using technology, kind of pushing us as an industry to create awareness so we can provide better care to our patients.
I'll never forget, and we try to bring in residents and interns in healthcare to our board meetings. And I remember we had a young man in, and one of the board members said, "What do you want to be doing in 5 years?" And the response was, "I have no idea, but I still want to be in healthcare, but it's changing so much. I hope I'm in a role that really challenges me with all the changes that are occurring." What a great answer.
That's a good answer. He has a broad spectrum, doesn't he?
He absolutely does.
So millennials are demanding changes in the delivery of care, more things online, like you mentioned. How quickly do you think systems are going to be broadly? How quickly do you think it will take to change the Titanic, in other words, and steer this in a more online, technologically delivered methodology?
I think every generation has brought about positive change. And I think our millennials are just the most recent example of that. And I think because of advances in technology, it's incredible to think it was 2007, I believe, when the first smartphone became readily available. And here we are just 12 years later, and it feels like smartphones have been around forever. That's an example of how rapidly change is starting to happen. So that Titanic that used to take, maybe years to turn because of advances in technology is turning much more quickly. I don't know that it's turning on a dime quite yet, but if we thought change would take 3 or 4 years, 4 or 5 years, I think change is happening much more rapidly, more in months as opposed to years.
John Phillips, Methodist Health System, thanks for being with us today.
My pleasure. Thanks for having me.
We mentioned in that segment that John told the story of how he got into healthcare. That is in our show number 3, which is in our podcast, The Human Side of Healthcare, available on all your favorite podcast players. Now, when we come back, do you know that home injuries around our own environment, are some of the most serious that can happen to you? We're going to go to Parkland Health and Hospital System to talk with one of the best about preventing injury. A little bit of awareness goes a long way. That's coming up next on The Human Side of Healthcare.
This is The Human Side of Healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
This is Steve Love. We're back with the human side of healthcare, and we're going to talk about a topic now that really impacts many people throughout the community. When you deal with injuries and how to prevent injuries, there's so many things that come into play. And our hospitals treat people with injuries every day in emergency rooms and trauma centers. And there are things we can do to help prevent that. So today we have with us Shelli Stephens-Stidham. She's the Director of Community Health Impact and Injury Prevention Center for Greater Dallas at Parkland Health and Hospital System. Shelli, welcome to the show.
Thank you, Steve. I'm happy to be here.
As we think in terms of injuries and preventions, what do you do specifically at the Injury Prevention Center?
Well, Steve, let me first say this. Many people may not realize that injuries are actually the leading cause of death for people 1 to 44 years of age in Dallas County. And a lot of times when we think about injuries, we think there's nothing that we can do to prevent them. But in reality, we can actually study injuries the same as we do many communicable diseases. And injuries, it's important to prevent injuries before they occur because they're disproportionately affecting young people. So people who are 1 to 44, they have traditionally should have more years of potential life to live. But because injuries are affecting these young people, then society loses what these people could have contributed either through family relationships, through the economy, and things like that. So it's important to understand that injuries can be prevented, and they are a true public health problem.
That's great work. And I was on the website of the Centers for Disease Control the other day, and accidents are like the leading cause of death in children. And that is so, so scary.
That's true, Stephen. And you use the word accident, and those of us who have been in the injury and violence prevention field for, and I'm going to date myself now, for me it's been over 30 years, but many years ago we tried to stop using the word accident because that word in and of itself implies that there was nothing that could have been done. And while these injuries are tragic, we want people to understand that there are things that they can do to prevent injuries and violence.
That's a great distinction, and I certainly understand what you're saying, injury versus accident. So the Injury Prevention Center, you've told us about it. When was it established, and why was it established?
Sure. So we just celebrated our 25th year in 2019. So 2020 starts our 26th year for the Injury Prevention Center. And we were established, and this was a true collaborative effort among many healthcare organizations within Dallas County. Parkland Health and Hospital System took the lead on this, and this is where we are housed, but we're actually not physically housed in the Parkland Hospital. We're more of a community-based organization, and this had the support of many of the healthcare organizations and facilities within Dallas County, including Children's Medical Center, Baylor Scott and White, Methodist, Texas Health Resources, and others. So we were established in 1984, and our sole purpose was to try and prevent to work with agencies, organizations, and other stakeholders in the community to leverage our resources to prevent injuries from ever occurring. And a lot of times people think that, well, the best way to do that is we need more education. We need to educate the individuals on how to stay safer and to not take as many risks and things like that. And we study injuries just like our physicians and trauma surgeons and others study their craft. And what we find is that education alone is ineffective in actually changing behavior, that the best way to change behavior is to work even more upstream and to change the systems or the environment or the policies that actually contribute to people getting injured. So we often say that we're trying to make safety the default, that people don't have to think about it. And I'm going to use a traffic safety example. Many cities across the country, including several in Texas, we're not quite there yet with Dallas, but we're exploring the possibility of looking at a Vision Zero policy. And basically what Vision Zero says is that every human is going to make a mistake. And when that human makes a mistake, whether they run a red light or they fail to put their seatbelt on or something like that when they make a mistake, we want the system to protect them. So if you're a pedestrian and you don't have sidewalks to walk on, that contributes to your chances of being hurt in a pedestrian injury or something like that. So that's basically what we're doing. We do a lot of, like I said, working with other agencies and organizations, trying to change systems, policies, trying to figure out what we can do to make the environment safer for all of our citizens and our residents, or our visitors.
In your mind, based on your experience, what is one of the single greatest causes of injuries, number one? And number two, to bring this home to our listeners, what are things they can do within their surroundings to help prevent injuries?
Sure. Well, for many years, traffic motor vehicle crashes have been the leading cause of death for not just Texas, not just Dallas County, but across the country. Those numbers are going down, and that's good. We're seeing safer cars. We're seeing safer roads. We have policies in place, such as seatbelt laws for everyone in every seating position. We have improved child passenger safety laws that require kids to be in appropriate size car seats. And so we need to build on that success. Now, the problem when you start reducing one cause of injury, often others rise to the top. And we are seeing increases in drug deaths. We call them poisoning deaths. Across the country, there's, and I'm sure many of your listeners know this, there's been large increases in the unintentional opioid poisoning deaths. In Dallas, we're still seeing increases in our illegal drugs and things like that, and that when people are impaired, that causes other potential for injury and things like that. And so we're starting to begin to look at some of those things. Hospitals, not just Parkland, but other hospitals are starting to put into practice prescribing methods and things like that. And then finally, we have increases in our suicide deaths and other types of death that involve firearms. A lot of people don't want to talk about firearms in Texas. I understand that. But the majority of our deaths, firearm deaths, are caused by suicide. It's not people. It's not homicide. So we're beginning to look at those issues and look at evidence-based strategies that are multifactorial and comprehensive to prevent those injuries and violence as well.
You know, you make some excellent points. And one final question I'd like to ask you: all this good work that's done and all the work to help the community to prevent injuries, but there are always challenges to any work we do. What are your main challenges?
Well, I think that the challenges are, and that's a very good question, Steve. Challenges are that it takes time to change systems. It's like trying to steer a ship and things like that. It can take years to get some policies changed. When we start looking at infrastructure and how to make it safer for people who bike or walk, those are infrastructure things that can take years to get funding. And the other thing is there's a lot of very good work being done in Texas and in Dallas County, and sometimes we get so busy that it is hard to we get very siloed into what we're doing, and I think that's why it's critical to try and be very collaborative, figure out what other stakeholders are doing so that we can, like I said, the Injury Prevention Center was established to leverage collective resources. And when we do that, we can have much bigger bang for our buck.
One of the worst injuries I ever saw in my time in healthcare was from somebody who slipped in their garage after coming home from a baseball game. Take note and keep it safe at home. I wanted to make you aware of our podcast. It's called The Human Side of Healthcare. It's on all the major podcast players, and you can email us if you have thoughts, comments, or suggestions, radio@dfwhc.org. Now, when we come back, healthcare is a hot topic these days, and we're going to discuss the social reasons why. Healthcare in our communities, next on The Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome back to the human side of healthcare. You know, today we're going to talk about a topic that is so important. People many times, especially the people that are listening to this show, think in terms of we go to the hospital to get treated for a medical condition or diagnosed for a medical condition. That is so true. But there are also social drivers of health, social determinants of health, if you will, that impact the health of individuals. And we're delighted that we've got with us Catherine Oliveros, who's Vice President of Community Health Improvement at Texas Health Resources. Catherine, welcome to the show.
Thank you, Steve.
Can you expand a little bit and help our audience understand the meaning of social drivers or social determinants of health?
Absolutely, Steve. So social determinants of health, or social drivers of health, because they're used interchangeably, really refer to the economic and social conditions that influence individual and group differences in health status. So it goes to the idea that a person's zip code, for example, is often a bigger factor in their health than their genetic code. So what does that mean? It means that in some zip codes, social or economic conditions are less than others, and so oftentimes the residents of those zip codes have disparities in their health conditions or experience disparities in health outcomes, and they tend to have poorer health because of things that may be lacking in their community. So perhaps they don't have an opportunity to exercise safely outside of their home because their neighborhood doesn't have walking paths, or it might not be safe for them to walk outside in their neighborhood. Or it could be issues like they don't have high-paying jobs in their community, and so the jobs that they do have, unfortunately, don't offer them health insurance, and so that limits their ability to stay healthy. So it's those types of social and economic conditions that indirectly or directly can have an impact on our health.
You know, I was talking to a school teacher the other day, and they mentioned to me, Catherine, some of the things you talked about, that a child who is at school whose teeth hurt, or a child who is at school that's hungry, they really aren't going to focus on their education.
That's exactly right. And, you know, it's interesting because I was at a luncheon this week, and the speaker was talking about her upbringing. And actually, it happened to be St. Williams, who is the CEO for the Dallas Mavericks. And she was talking about her story and the fact that she grew up in poverty. But what really touched me about her presentation, her sharing her story, was the fact that she talked about the role education can play in lessening some of these conditions and really moving people out of poverty. But the challenge is that, to your point, children who are hungry or who are not feeling well, they're not properly learning in school, and so they're stuck in that cycle where they're not necessarily able to use education as a way to improve their opportunity in life and, in turn, what they have access to in terms of opportunities to have better health.
You know, that's right. I happened to be at that same luncheon. I didn't know you were there. In fact, she really motivated us. She actually got me get up and dance. As you know, you were there. She got us all to kind of do a little shuffle. So that was pretty impressive. Hey, another thing that we hear people talk about is going upstream. We need to get upstream. Can you explain to our listeners, what do we mean when we say that?
Yeah, so upstream, I'm my background is in public health, and I lovingly call myself a public health nerd. And we use the term upstream often in our field, and it really just means all about prevention, right? It's getting ahead of the problem and addressing issues that end up getting us those poor outcomes that we see when we're more likely to be reactive. And so by going upstream, the idea is that you are tackling issues before they become bigger problems. And in my setting, why I'm fortunate to work at the place I do at Texas Health Resources and lead the work that I do is that we have an opportunity to look at communities and really try to understand not just the social determinants of health that impact their health outcomes, but really look at upstream opportunities that we can support and partner around that are going to make a difference in those health outcomes.
You know, Catherine, in the role you have, and not only the good work you do at Texas Health Resources, but all our hospitals, how do you perceive or set priorities as to the needs of the community? What tools do you use to determine the needs that you need to address?
Yeah, that's a great question. And Steve, I appreciate that you asked it because it gives me a chance to plug the amazing work that my team has led in the last 18 months. So as a nonprofit hospital, we do a needs assessment, a community needs assessment, which is basically a roadmap that helps us understand the needs and opportunities in communities and really helps us focus how we're going to work in those communities as a hospital system. And 2019 was our year to complete our newest version of the Community Health Needs Assessment. And so for those of you who are interested, you can definitely go to the Texas Health Resources website and find it there. But the CHNA is our foundation for everything that we do. Like I said, it's the roadmap, so it helps us understand what the gaps are, what the assets are in communities. It helps us understand who we can partner with, and looking at it from a cross-sector perspective. So it's not just about what other hospitals are there that we can work with, but it's also about the schools that are present, the employers that are present, the community-based organizations, most importantly, that are present, because oftentimes those community-based organizations are the organizations that really help us implement programs. They're the feet on the ground. They're the pulse of the community, and they do tremendous work. And so the CHNA allows us to understand who's there, what work they're doing, and how we can better align and support that work towards a shared goal, which is really improving community health in general, decreasing the disparities that we know exist, and providing more access, culturally appropriate health education, and just being a resource to the communities.
You know, that's a very good point. You really want to impact the communities you serve. That's part of this show, the human side of healthcare, and how the hospitals here in North Texas are trying to improve the health of the community. For our listeners, though, Catherine, let me step back a minute. Why are hospitals really involved in caring about poverty, transportation, housing, all the things that you think of other than treating someone that's sick? Why do hospitals get involved in this?
You know, for Texas Health, it really goes back to our mission and vision as an organization. Our mission is to improve the health of the people in the communities we serve, and that's everyone, not just those that we see within our hospital walls. Our vision is to partner with you for a lifetime of health and well-being. So that means really serving as a resource and as a community partner across the health continuum, not just when you're in a moment of crisis. And so for us, it's important in order to really fully fulfill the mission, it's important for us to look at health holistically. So in my area, we have some very specific guiding principles that help us focus and remember why this is important work that we do. And so our first guiding principle is that we view our communities through a lens of health equity. And that's really about understanding fully what factors influence health and what are some of the barriers that people face on a daily basis as they try to live their healthiest selves. We, in our area, target underserved populations because we know that they are more likely to have poorer health outcomes. And so it's our mission to go to those communities and to work with those populations so that we can again, partner with them for their health and well-being. We have committed to going outside of our hospital walls and really going where people live, work, play, and pray. And that's an important part of living our mission, is really going where our communities are instead of having them come to us, recognizing that they might have barriers, transportation being a perfect example, in coming to us and trying to seek preventive care or holistic care in one of our settings, and recognizing that as a hospital, to keep people healthy, we shouldn't just be thinking about the clinical care that we provide, but we should be understanding that to be a true partner in the community, we don't have to become an expert in education, or we don't have to become an expert in housing, but we should be at the table where those folks are and be talking about how we could work together to improve those conditions and, in turn, improve overall community health.
You know, healthcare is already a big part of the political debate, and we're going to be hearing it all year. And these social drivers of healthcare are a main part of that conversation. Now, when we come back, we're going to check in with Dr. Philip Huang. He's with Dallas County Health and Human Services. We're going to get an update on something that has not been in the news lately, thank goodness, the HIV virus. Is it resolved, or is it still among us in the Dallas-Fort Worth area? Dr. Philip Huang on the human side of healthcare, next.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome to the human side of healthcare, and we're delighted that we've got with us today an individual who really supports good public health. He's the director of the Dallas County Health and Human Services, Dr. Philip Huang. Philip, we are delighted you're on the show.
Thank you. It's a pleasure to be here.
In North Texas, but specifically in Dallas County, is HIV still a problem?
You know, it really is. And HIV is this epidemic that we've seen from the start for many of us. It started in the 80s and early 80s, and then, grew exponentially. Then we've had successes with some of the treatments and things. So the deaths due to HIV have dramatically decreased, and so people are living like normal lifespans now with HIV. But we haven't solved this, and so it's still a significant problem in our community. We have, I think, currently in we call it the service delivery area around Dallas, which is a multi-county area, Collin, Dallas, Denton, Ellis, Hunt, Kaufman, Navarro, and Rockwall. We have about a little over 22,000 people living with HIV in these areas, and it's almost 1,000 new diagnoses of HIV in this Dallas area that we saw in 2017. So it is definitely still a problem. Again, some people forget about HIV, but we're still seeing these large numbers of new cases. And when we look at the number of deaths, and that's sort of flattened out, and we haven't leveled off, and we really need to reduce those also.
Yeah, leveling off is one thing, but you're exactly right. We need to do everything we can to reduce that. Many of our listeners may not realize, and so as we talk about this from our listeners' point of view to really comprehend this, what would you say are the groups that are most affected by HIV currently in Dallas County?
Sure. And we look at both the people living with HIV and then the new diagnoses. And so for both the people living with HIV and new diagnoses, probably male-to-male sexual contact is the primary mode of exposure and acquisition among the people living with HIV and among the new diagnoses. By age, now the people living with HIV, it's an older group that are living with HIV. The majority is for people living with HIV split between age 25 to 45 and then 45 to 64. But when you look at the new diagnoses, it's about 60% that are between age 25 and 45, and then another 22% that are less than or equal to 24 years of age. So the new diagnoses are really in a much younger group. People living with HIV are significantly older. By race, the majority of people living with HIV and the new diagnoses are among black individuals. And but we're also seeing in the new diagnoses significant Latinx percentage. So those are the groups that we're seeing as most affected currently.
You know, this show is titled The Human Side of Healthcare, and so certainly, you know, we're trying to help educate our listeners, and we're trying to help our listeners understand some of the things that are going on. And we can have interviews and we can talk about statistics, but action really comes into play. So I would love for you to kind of highlight, what is Dallas County doing to address HIV currently?
Yeah, well, we're really excited about some of the activities that are going on locally to address HIV. Dallas County and City of Dallas signed on to, it's part of an international movement to be a fast-track city and county to end the HIV epidemic. And so this was earlier in 2019. Judge Jenkins, Mayor Johnson had signed the Paris Declaration to end the HIV epidemic. And so that really commits our community to trying to accomplish some very specific goals. We have talked about 90-90-90 by 2030, where 90% of all persons living with HIV will know their HIV status. 90% of those persons will be on sustained treatment, and 90% of those persons will be virally suppressed. And then we're also looking at some targets. Now it's moving to 90% reduction in new cases by 2013 and reducing the stigma and eliminating this negative stigma that is seen with HIV. And so, we're really we're bringing a lot of community partners together to work on this collectively in the areas of prevention and preventing new infections and testing and rapid linkage to care. So getting people tested so they know their status to accomplish that first 90% goal that we have, and then getting people rapidly to treatment. It's a very different now experience for people. It used to be people might be told, okay, tested, and then told, hey, your test just came back positive for HIV, come back in a few weeks, and but now we can say, well, your test just came back positive for HIV, but you can start treatment immediately, and in 48 days or so, you can be virally suppressed and you can expect to live a normal life. But so it's a very different message that is able to be given now. One of the other goals is retention and re-engagement. Keeping people in care so they can stay virally suppressed, but then also people who are lost to care, getting them re-engaged so that they get on treatment and can get that viral suppression. Because when you're at that viral suppression, you also can't further transmit HIV. And so there's a whole campaign even that U equals U, where undetectable equals untransmissible. And so that treatment is actually also prevention. And then some of the other efforts that we're working on, again, is ending that stigma that prevents. It's a barrier in so many levels of addressing HIV.
Terrific work that you're doing, and I've been to a couple of the meetings on the fast track related to the work you're doing on the 90-90-90 goals, And I must say, the first meeting, there was standing room only, which brings me to my final question. Why is there now, in 2020, more interest in addressing HIV?
Yeah, it really is an exciting time, and we have new and effective tools to try to turn around the HIV epidemic. We have, as I mentioned, effective antiretroviral treatment, which again can lead to dramatic improvement in quality of life and life expectancy. I mentioned undetectable equals untransmissible. We have, as I mentioned, also rapid start, so getting people quickly onto treatment after they've been their test has come back positive, and more resources to link people to care and keep people in care. And then there's even more resources for doing these anti-stigma campaigns. Another new tool out there is PrEP. It's called pre-exposure prophylaxis. This is a pill that people who are at higher risk of HIV can take a pill a day and prevent from getting HIV. People who are who do not have HIV but maybe at high risk can take this pill, and it prevents them, and it's very effective at preventing them from getting HIV.
Phil, you have just been terrific for our listeners, giving them a wealth of information, and we just want to thank you for joining us on our show today, and we appreciate your leadership in public health in North Texas.
Well, thank you for having me.
You've been listening to The Human Side of Healthcare. We have a great podcast on all the major podcast players under that same name. And you can hear our past interviews, including last week's show with Janet St. James. If you missed that wonderful interview, just look up The Human Side of Healthcare on your favorite podcast player. And our email is radio@dfwhc.org. Next week, a very relevant conversation about behavioral health with Sandy Potter from Texas Health Resources. We'll see you again next week on The Human Side of Healthcare.